Okay, so today we're going to walk through what it looks like when you click on the Health Sherpa link below this video. So we're going to take the example of a person living in Chicago, Illinois, on the north side of Chicago. So I believe zip code is 60647. Let's assume this person is 35 years old, female, and let's say they're not a tobacco user. They're not the parent of a child under the age of 19. They're not pregnant, and they are currently not eligible for other coverage. Let's assume this person is not married, and it's just considered a household size of one, even if this person has roommates. If this person is not filing an income tax return jointly with another person or claiming children on their income taxes, that would be a household size of one. And now for household income, it's asking for the annual gross income that you expect to make for the year you are applying. So in this year, it's 2025. Let's say the approximate household income for this person is going to be $50,000. So then on the right side, you'll see that it says estimated savings. So these are the tax credits or the financial assistance that you could receive based on the plan that you select. So then we go down. Look at all these results. We have 100 plans that came up, but 100 plans is overwhelming to look at. So there's actually a filter on the right side to the right of where it says plan year 2025, and there are different options that you can select. There's lowest premium, lowest deductible, lowest max out of pocket, and the in-network provider. In order to see which option would be the best for you, it's important to first complete the needs analysis that's also in the description of this video. So to keep this video simple, let's say that this applicant is only interested in the lowest premium or the lowest monthly payment. So we'll keep it as it is. Now, for the purposes of this video, I won't select any providers or any prescriptions, but on the left-hand side, as you can see, you can add doctors, hospitals, clinicians, and so forth just by selecting add a doctor, and you can see, start typing a name, and then you have a bunch of different options that come up, and then you can just add it, right? And then for prescriptions, same thing. Let's see, I think so you start typing the name of your medication, and then you would just add it to the list, and then you hit done down here, the blue little rectangle. Okay, so if you have any particular carriers that you want to stay with, let's say you want to stick with most people are familiar with Blue Cross and Blue Shield, so let's select that. Let's say Ambetter is another one, and let's say United Healthcare. And you know what? We'll select one more. We'll say Aetna. Aetna for the purposes of this video. So now you went from 100 plans to 76 plans. So you have a 25% reduction. So we'll go down here. Now the metal levels are just based, what it comes down to is what you're going to pay out of pocket and what the insurance company is going to pay on their end. So this goes from most expensive to least expensive. The gold is the most expensive on your end, but you also have most of your services covered. Most people are going to get a silver plan. If you want the lowest out-of-pocket cost, you will go with an expanded bronze plan. And if you qualify, if you are under the age of 30, you can get a catastrophic plan. So we could see, let's see, we'll look at silver plans to keep it simple. And now we went from 76 plans all the way down to 26 plans. Okay, so now it's getting easier to verify. The networks, you would just choose what kind of network. If you're a person that travels and you like flexibility, go ahead and select the PPO network. If you're a person that doesn't travel as often and you value affordability, select HMO. So we'll select HMO for the purposes of this video. Now we scale down to 19 plans, and then easy pricing, which is the additional filter, or eligible for an HSA, a health savings account, right? We'll just keep that blank. Now as we could see, we can compare 19 plans, but there's still a lot of work to do, right? Just so we could see, you have 2 pages here. Now, to keep things simple, if you want to keep your cost low, what we could do is actually, here, we'll do this. So let's say you also want to get dental and vision. Okay, very simple. So as you're going down, right, there will be some plans that include dental and vision. So, and as you can see, the deductibles are going to range. So you have $5,000 deductible, $6,300 deductible, $5,000, $7,495, and then, oh, this is nice, is a $0 deductible plan. Okay, doctor visits are no charge. Okay, so, and this is a silver plan. Now this one, actually, this one is 327. So comparing it to this one is 309, right? So it's important to read the description here too. So this one is 309, it's from Aetna CVS plan, and then this one is 327, it's also from Aetna CVS plan. So you may ask, hey, why is, if they're both zero deductible, why is one $309 and one is 327? Well, you can actually compare them. Let's select it where it says compare, and we go down here. We hit compare two plans. So as you could see, this one on the left is 309.73, and on the right it's 327.71. Well, the difference in price is due to the one on the right, same company, same zero deductible, but the one on the right has dental and vision. So then you would go through the deductible. They're both $0, max out of pocket. If you haven't seen the video on health insurance for beginners, the link is in the description to make it easier for you. They're both HMO networks. Anytime you go to your primary care physician, there's no charge, which is nice. If you go to a specialist like a cardiologist, a gynecologist, an endocrinologist, and so forth, there's a $60 charge. That charge gets applied toward the reducing your what's known as the max out of pocket for the health insurance plan. There is a deductible of $2,000 per person. However, this is only for certain medications. Otherwise, because medications are grouped into tiers. Otherwise, generic drugs are going to have a $19 copay. But if you find that it's going to be more affordable to not use your health insurance to get medications, go ahead and go that route. Or sometimes you can get a discount prescription card at the pharmacy, depending on which pharmacy you're going to. The emergency room copay is pricey. It's $2,220, $2,200. Urgent care facilities has a $50 copay, and then your hospital stay is $2,500 per day, but you're capped at your max out of pocket, which is $9,195. Now, this is why it's so important, if you don't have any living benefits life insurance, to also check the video out on that and check the resources in the link, so you are not having to take money out from your savings or your retirement account if you are a saver or you're planning for your retirement now, and instead you have insurance that's low cost that kicks in and helps you pay for these health insurance out of pocket expenses. Okay, so let's say that you like this plan, everything seems good, 327.71 per month, you add it to your cart, you start the application, and then it's going to ask you certain questions. So it's going to have you, and it's completely safe. So this is it's HIPAA compliant, and it's also SOC2 compliant. So your information is not going to get dispersed amongst a variety of different companies. No, it stays on this platform. And if you want to revisit it, you can revisit it. If you have any questions, you can contact the information or the person that's on there. But as you can see here on the left-hand side, it's going to ask for your primary contact information, your household information, the members of your family, your income, additional questions, and then you finalize it. And then you could either choose to pay at the end of the application process. You can choose to pay right away for the plan. So in this case, if you'd be applying at the end of the month, your plan would start at the very beginning, the first of the very next month. And you can choose to make your payment at that time. Most people will choose to make their payment right away. And that's it for now. It's pretty straightforward. If you have questions regarding like subsidies, which a lot of people typically get hung up on, and you want to ensure that you're accurate in that sense. Otherwise, it's going to throw off what kind of assistance you may be eligible for. If you have questions regarding that, you can book an appointment using the link below. Otherwise, hope this was helpful.